Fibromyalgia is one of the worst chronic illnesses that causes pain all over the body, sleep disturbances, and emotional and mental distress. But diagnosing the root causes of fibromyalgia can be the secret to relief. Hi, I'm Dr. Arianne Missimer. I'm a functional medicine practitioner, a doctor of physical therapy, and a registered dietitian. And today we are going to be talking about a functional medicine fibromyalgia protocol that includes lab testing, therapeutic diets, and supplementation. So what is fibromyalgia? Fibromyalgia is actually quite a complex condition. It is referred to as a neurosensory disorder or a central nervous system processing disorder, where we have amplified pain. So there is a hypersensitivity to pain that's often associated with something called allodynia. So for example, if you were to have some sheets or light touch brush past your skin, you might have a abnormal response to pain where it feels abnormally high. I like to think of it as the volume is dialed up. So the pain is amplified and we have a decreased ability to dampen the pain. So what are some signs and symptoms of fibromyalgia? One of the cardinal signs of fibromyalgia is widespread musculoskeletal pain. This could look different for each person, but it can present as muscle pain and fascia pain, but it can also present as joint achiness as well. But either way, this heightened sense of pain is very prevalent among all fibromyalgia patients. In addition to that, another cardinal sign is often associated with sleep disturbances. Those sleep disturbances can be associated with the pain, but it can also be associated with other things such as high cortisol and so on. So either way, that tends to be very prevalent in patients with fibromyalgia. And then of course, there's the cognitive symptoms. So this can be anything from brain fog, often referred to as fibro fog, where you just can't remember what you're doing. You go into a room and you forget totally what was happening. Or things like anxiety, depression, memory loss. All of these can be very common, as well as things like headaches and migraines. So what causes fibromyalgia? So at this point, it does remain elusive as it relates to research of what is the underlying cause, but there are definitely underlying factors such as physiological, genetic, and environmental. From a physiological standpoint, as I had mentioned, that we have a disruption in our pain processing. We refer to this as central nervous system sensitization. So we are having an increase in these excitatory neurons that are signaling to our brain that there's more pain. We have a decrease in what's called anti-nociceptive receptors, which think of nociception means pain receptor. So we don't have the ability to dampen the pain. We also have a dysregulation in dopamine, and we have an increase in endogenous opioids. As it relates to genetics do play a role in fibromyalgia. However, it is not the sole reason why someone may experience fibromyalgia symptoms. And then lastly is, from an environmental standpoint, trauma is associated with fibromyalgia. It can often be initially triggered by emotional and or physical trauma. So what are some functional medicine tests that we can use to test for the underlying causes of fibromyalgia? Because as we know, with the diagnosis of fibromyalgia, it is typically diagnosed by a rheumatologist looking at specific tender points on the body. So if you have pain for over 3 months and 11 out of 18 of those spots are painful, that is going to be classified as fibromyalgia. So we want to understand what are the root causes of this. So as we're looking at functional medicine testing, we want to think about first our routine blood work, because we want to see if there's any other things that we need to rule out, such as any liver condition, if our liver enzymes are high, if there's thyroid disease, if there's an underlying autoimmune disease or chronic infection. So in this case, we want to look at things like a CBC, a CMP. We want to look at an infectious panel to make sure that we're really addressing any potential underlying or associated conditions. We also want to look at a comprehensive stool test, so such as the GI map test. So this can be really powerful to help us understand what is happening in the microbiome. Is there underlying parasitic infection or H. pylori, for example? Is there opportunistic bacteria that are contributing to systemic inflammation? What does the intestinal health look like, which can give us insight to the absorption of specific nutrients? Is there leaky gut? Is there an overactive immune system or underactive immune system in the gut? A micronutrient panel could be extremely valuable. So this can look at all of the micronutrients to be able to understand your biochemistry a little bit more. So things like magnesium deficiencies, B12 deficiencies, vitamin D deficiencies, all of these can be associated with fibromyalgia. And it's also things that we can address specifically from a nutraceutical approach through food first, and then potentially supplementation to be able to improve your healing. We can also use the Dutch test. This can be super valuable because fibromyalgia happens more in women than in men. And so oftentimes there can be dysfunctions in the HPA axis, so the hypothalamic pituitary adrenal axis, our stress pathway of our body. And there can also be associated menstrual issues and other hormonal imbalances that can be identified much more in depth through the Dutch test. And then also the OAT test, so the organic acid test, which can be really valuable to look for nutrient deficiencies, neurotransmitter imbalances, oxidative stress, bacterial dysbiosis. All of these things can give us a much more complete picture of what's happening. What's amazing about this is that all of these tests are accessible to us. Rupa Health has provided wholesale pricing for labs that we have access to, that we can understand more about what's happening from an underlying root cause medicine approach. So how can we go about treating this very complex condition? So first, we want to think about treating any underlying cause that we found through our functional medicine testing. So if there was a gut infection, if there was a viral infection, we want to make sure that we're addressing these very specifically. But beyond that, now we want to think about how can we begin to optimize lifestyle factors, including nutrition and movement and sleep. And so from a nutrition standpoint, there has been various studies that have shown that different diets can be very helpful for chronic pain. For example, a Mediterranean diet, which is one of the most well-researched diets, is essentially an anti-inflammatory diet, and that has been shown to be helpful, as well as a low-carbohydrate diet, a healthy ketogenic diet, and even a low-FODMAP diet. Now, this might depend on where you are in your journey. What is most realistic for you? Are there any underlying gut issues, for example, where a low FODMAP plan might be very helpful? But you want to think of it from an overall nutrient repletion standpoint. So we're thinking of whole foods, fibrous foods, which is really important for a healthy microbiome, that are promoting optimal health and well-being. Beyond that, we want to think about, of course, supporting with a high-potency multivitamin. This is important because the majority of Americans are deficient in at least one or more nutrient. This can support neurotransmitter synthesis, energy production, and immune function. Next up is fish oil. This is going to be extremely important for omega-3s, which can have a profound effect on inflammation. Not only does it affect inflammation, but it also can decrease severity of migraines and headaches. It can improve depression and cognitive ability. So it is something that can be very helpful in chronic pain, also as it relates to joint and muscle pain. The recommended amount here is going to be 1,000, really more preferable up to 2,000 milligrams of EPA and DHA, for at least 3 to 6 months. In addition to the multivitamin and omega-3, we also want to think about magnesium. So magnesium plays a role in 700 different reactions in the body, and there's 8 forms of magnesium. In this case, we want to think about magnesium malate. This can have a really helpful effect on muscle tone and skeletal function. Typically in patients with fibromyalgia, they are going to have lower levels of magnesium. So you can do an individual supplementation of the magnesium malate, or you can do a multi-form magnesium, which can address a lot of other aspects that might be associated with some of the symptoms. The recommended dose for this is going to be about 300 milligrams, and that could be taken for 3 to 6 months. And lastly is 5-HTP. So that's hydroxytryptophan. This is a precursor to serotonin. So when we have lower levels of serotonin, this can contribute to things that are associated and symptoms associated with fibromyalgia. So there was a 90-day clinical trial that showed that taking 5-HTP can decrease pain intensity. Now, the one thing to consider with 5-HTP is that, one, it should be recommended by a credentialed provider and a qualified provider. Because if you are taking a SSRI, a serotonin selective reuptake inhibitor, then you do not want to take 5-HTP because you are at risk of serotonin syndrome. So you do want to just make sure that this is prescribed appropriately for you in your health journey. And of course, beyond very specific interventions, as I just mentioned, we also want to think about all of the other lifestyle interventions that are critical for fibromyalgia and chronic pain. Things like optimizing sleep, psychotherapy to address any type of emotional trauma that you may have experienced. We also want to think about graded exercise. Unlike high-intensity interval training, we want to think about slow, graded, intentional exercise that is progressed over time. Managing nervous system regulations. That could be in the form of vagus nerve exercises, such as diaphragmatic breathing, humming, abdominal massage, or other practices. I hope you can see the value in looking for the underlying causes of fibromyalgia, being able to test, especially with the options through Rupa Health, and also being able to treat more intentionally, being able to look at everything from a comprehensive perspective so that you can heal your body. Hi, I'm Dr. Arianne Missimer. I'm a functional medicine practitioner, a doctor of physical therapy, and a registered dietitian. If you want more videos on root cause medicine, make sure to subscribe to our channel.